Welcome back to What's Now. Right now, we are going to focus on frontline workers, especially during this tough year and the pandemic. Unfortunately, many are struggling with their mental health. They struggle with stigma and getting help. Let's find out what we can do to help reduce this problem and help our frontline workers.
A new survey from Mental Health America shows majority of healthcare workers are now experiencing mental issues such as stress, anxiety, and burnout due to prolonged COVID-19 pandemic. Joining me today to talk about this is Paul Gionfriddo, President and CEO of Mental Health America. Paul, thanks for being here today.
Thanks for having me on.
So why did you decide to survey healthcare workers, and what were some of the results?
Well, we felt that a lot of people were paying attention to the physical health aspects of the pandemic, and particularly the impact on the physical health of healthcare workers, but not enough people were paying attention to the emotional or mental health impacts of the pandemic on our frontline workers in particular. So we figured we would survey them and see what they were telling us. And what we learned was that more than 90% said that they are experiencing a great deal of stress, more than 80% a great deal of anxiety. And while 68% were physically exhausted, 82% were emotionally exhausted. So the emotional health impacts of this pandemic, we found, are being felt deeply in the caregiving population.
You know, it definitely makes sense based on what is happening, but those are some really high numbers. Were you surprised at these findings?
Yeah, the numbers are really high, and the numbers in the general public are not quite that high in the pandemic right now, where maybe a third to a half of us in the general population might be experiencing clinical diagnosable anxiety or depression this year. And among young people, it's an even higher number of people. But I think one of the most surprising things that we saw in this was that, more than half of the people who responded to the survey are actually wondering if this is the right occupation for them anymore. So if we lost half of our healthcare workers because they just give up after this pandemic is over, we're going to be feeling the effects of that for years to come too.
Yeah, that's a really awful thing to think about. Why is there a stigma about mental health and healthcare workers, and what can be done about it?
Well, I think there are a couple of things. One is that these are people who are used to taking care of other people, and they're used to giving, and so they feel guilty if they're the ones needing help and feel as if they're taking time away from somebody else. And I think the second issue is that they often feel, and we've been told, that it's a sign of weakness if you need to ask for help. In fact, it's a sign of strength that people know their limits and can set some boundaries and understand when they need to call on other people to help them. But we need to work on both those aspects so that people don't feel guilty about seeking help and understand that it's a strength to seek help when you need it.
What can people do if they themselves are struggling, or if they know someone who they feel might be struggling with anxiety or burnout? What should they do?
Well, I hope that people will not guess about what's going on. And a lot of us have spent the year guessing about whether the worry we're feeling is something more significant, like anxiety or depression. We offer free anonymous mental health screens on our website at mhanational.org and or directly at mhascreening.org. And people can take a mental health screen and get an answer and get some information. At mhanational.org/frontline, we're also offering and have amassed a lot of resources specifically for frontline workers so that they can get tools and information they need in order to take care of themselves so that they can continue to take good care of the rest of us.
And anything else that we should know, any other resources or information about mental health and frontline workers?
Well, here's the thing that I think we should just keep in mind about frontline workers is that while they're experiencing many of the same anxieties, for example, that the rest of us are experiencing, the way it's manifesting for them may be a little different. So many are telling us that sadness is an emotion that they're feeling. And it makes sense when you consider how many lives we've lost in healthcare facilities, whereas the rest of us, not that high a percentage of us experience that. They're also saying that they're not taking care of their families as well as they want to. So it's not just the physical side, they're also worrying about, are they taking care of the emotional needs of their children, of their loved ones, and doing all the things at home they need to do. So I hope that we will understand it's time to give our healthcare workers a break. And the best way for us to do that, honestly, is to take care of ourselves and not get sick over the course of the next month so that we can begin to relieve them of some of their burdens as we hit the beginning of the new year and give them a chance to get a break and take care of themselves.
Well, thank you so much, Paul, for joining us today here on Park City Television. Such an important topic. Hope that people who are frontline workers, really anyone that's struggling with mental health, can find the help that they need.
Thank you.
Thanks for watching this episode of What's Now. I'm your host, Christine Napier. Happy to have you here. Be sure to tune in to Park City Television. You can head to our website, parkcity.tv, for all of our programming information. And don't miss out on our live show every day at 8 a.m. Mountain Connections. We'll see you next time.